Okay. All
Did it
set.
go?
Yep.
All
Just
right, great. Hi, everyone. My name is Jessica Deering. I'm the Executive Director for the Cancer Action Coalition of Virginia. Thanks so much for inviting me to share a little bit about our organization and the Virginia Cancer Plan. I have a number of slides here I want to share with you. I thought I would give some background about who we are and sort of the national framework in which we work within. We are Virginia State Cancer Coalition, and if you're not familiar, the CDC about 25 years ago created the Comprehensive Cancer Control Program. And through that program, they give funding to every state to develop a cancer plan and to have a coalition which brings all of the partners together in the state who are working in cancer control and prevention. And they develop the plan together, we implement it, and then we evaluate our efforts. So it's really the coalition really is, as we say, anyone interested in cancer in Virginia can be a part of our coalition and help us try to reduce the burden. And our main focus is to develop Virginia's cancer plan. And we do that every 5 years. This is a picture of our current plan that we have. It was released in 2023 and it's through 2027. This is the fifth version of Virginia's cancer plan. So we've had one for 25 years, and it really serves as our roadmap in how we address cancer in the state. Why do we have a plan? I just want to share with you, and I know your focus is on pediatric cancer. I'm going to talk a little bit more about that later, but this is really some fast facts about cancer in Virginia. So, 4 in 10 Virginians are likely to develop cancer in their lives. We have over 400,000 cancer survivors live in Virginia. 62% of Virginians live 5 years after a cancer diagnosis. And the four most common cancer diagnoses in Virginia are breast, prostate, lung, and colon. The good news, if there is some in here, our rates of cancer deaths are declining. However, we still have so much more to work to do. So the cancer plan focuses on these 6 areas: prevention, early detection, diagnosis and cancer-directed therapy, survivorship and palliative care, pediatric, adolescent, and young adult cancers, and then health equity. So 2 things I wanted to point out here. Virginia was the first state to include pediatric, adolescent, and young adult cancers in their cancer plan. And we are only a small handful of states that actually include that. So we're proud that we do that, that we consider our youngest cancer patients in our plan. And I'm going to get a little more into what's in that later. And then health equity. Some states put health equity as a separate section of their plan. We don't in Virginia. When we first met to develop this plan, we talked about that. And so when you look at our plan, you'll see that that is addressed in every aspect of it. So really the plan is we use data and it provides us guidance, information, and resources so that any Virginian can look at this and understand how they can reduce their risks, their family's risks, or make their communities healthier. I'm just going to share with you. I didn't want to just skip over to pediatrics because I think we're all interested in cancer. So there's probably some information here that might be useful to you in other aspects of your life, but of what is in the plan and very brief on the other aspects. So our prevention plan is the first section, and that really encompasses things that people can do to try to prevent cancer. So we have our goal number one is to reduce use and exposure to tobacco products. We talk about dietary habits and physical activity and alcohol consumption. And we also do a lot in trying to promote the HPV vaccination, which can uh, prevent 6 types of cancer. And the HPV vaccination, we work to try to get children starting at age 9 vaccinated for HPV. And then in this section, we also talk about sun exposure and other types of environmental things. And then the early detection section is that we believe cancer screening saves lives. So we encourage people and work to have people who are eligible for a cancer screening get that screening. And this has a list here of those that there are screenings available for, or there are ways to do some early detection. And then our diagnosis and cancer-directed therapy section really talks about having access to treatment and care and clinical trial participation in the state. And then our survivorship and palliative care section really talks about having access to survivorship programs for patients and families and some of the financial hardships that come with a cancer diagnosis and how can we alleviate some of those things. And then there's information of improving our palliative care services in the state. So it's a pretty big section, survivorship, but there's some really great work we're trying to do. And now I come to the pediatric, adolescent, and young adult cancers. So the cancer plan is broken down into these sections, but then we have 18 goals. And if I didn't say this earlier, I always like to tell people it's not a light read. It's a 65-page document. In Virginia, it is comprehensive. We have tried to think of everything related to cancer, but that's great because we really are understanding what's happening in the state. So for pediatric, these are our goals. I'll just briefly share those with you to improve long-term follow-up care for childhood cancer survivors, to improve support services for pediatric patients, survivors, and their families, to increase awareness of palliative care strategies for children with cancer among healthcare providers, patients, and families, and to address the financial burdens of pediatric patient survivors and their families. I wanted to show you an example of what the cancer plan looks like if you get into it. And so I pulled one of the objectives and then how we talk about that in the plan and worked on it. So within a goal, then there are objectives. So for this one, this objective is all pediatric cancer treatment centers will have a policy of providing collaboration between medical oncology and pediatric oncology for AYA patients. We like to have the data and then we like to have a target. So where we are when we create the plan is our baseline, and then our target is where we hope to be at the end of the 5 years. So as you'll see for this one in the cancer plan, there's a number of objectives that we just don't have data for. So that's to be determined for this one. And then we try to identify some strategies that can help us achieve this goal. And so I won't read through these, but these are some interesting things that have been come up with that the group that put the plan together believes might be our steps to get there. So each goal then has objectives in the plan, and then it has strategies and the data that's associated with, and that's what it looks like. And then I just want to share sort of an overview of really health equity in the plan, and some specific areas that we do focus on in Virginia. We do focus on the needs of our LGBTQ community and our Black and Latino populations, and then our rural communities, including Southwest Virginia. This is, of course, not all comprehensive, but it is some of the target areas where we have focused some of our efforts. So that's a lot of information. So how do we do this? So the coalition has identified certain parts of the plan where when we look at the data, we think we really need to do some work here. It's all really important, but it's a lot. So how do we focus our efforts on where we might have the most impact? And so we've created what we call cancer plan implementation teams. So we have, I'll just go through this. We have one that's focused on colorectal cancer, one that's focused on HPV immunization, breast cancer, and then our patient navigator network, which are professional navigators who come together and they help in all aspects across the continuum. And then our cancer survivorship roundtable, they focus on the survivorship goals I mentioned, and then our lung cancer roundtable. And then I think it was in 2024, we started, not officially, but our pediatric oncology group. And it's really bringing people together who are interested in the pediatric aspects of the plan and the work there, and to maybe bring a larger group together to work towards those. So that group has met once or twice, but we're really hoping to make it official in 2026. So if you're interested, you can let me know. And then when you look at the cancer plan, you'll see that there are a lot of objectives and strategies related to policy. And so a year and a half ago, 2 years ago, we created the Advocacy and Policy Committee to really help us focus on some of those things and help move those forward, those goals and objectives. So the cancer plan is really for everyone, and everyone has a role in helping us meet these goals. So it is every Virginian, it's government, it's business, it's healthcare providers. It really truly is everyone if we're going to make a difference. So, how do we know how we're doing? We track our progress. So, this is an example of our progress dashboard that lives on our website under the cancer plan. And it's updated annually when we receive new data from Virginia's Cancer Registry. And so we list every goal, then the objective, and you can see here on the screen I just pulled. This is talking about our tobacco control goals. And so it's color coded in blue is we're moving in the right direction from our baseline to our target and where we are in this current year. And then red is where, wow, we're moving away from our goals. And I think gray is where there is no data and we're not sure where we are. So it's really interesting to go in this. You're working on this and you have all of this to do, and then you think, how are we doing? And it's just, I think we just added this in 2023, and it's really gives our members some good feedback to know we're moving in the right direction, but also really important to know where we really need to put more effort. And so even though the red is hard to see, I think it's valuable for us to know. So I know that you're an advocacy group, and I just did want to share a few things of some of our advocacy and policy efforts that we have worked on in the last year or so. This year in 2025 has been challenging for us in the sense that all of our focus has really been on the federal changes to funding and our in priorities. So that comes because we work with so many organizations across the state, the research centers and the impacts that they may see due to reduced funding, and then our public health colleagues who the Virginia Department of Health, they receive a lot of federal funds, and some of those have been canceled or frozen or potentially may end. And so, how do we keep the good work that we're doing in Virginia going, even though their priorities have changed at the federal level as well as funding? And so, we've worked a lot with our colleagues to try to ensure that if we lose federal funding, maybe that there'll be state funding. And so some of that has come into tobacco control programs, our Every Woman's Life, which is a breast and cervical screening program. Our cancer registries had some challenges as well as our research center. So we've really focused some efforts there. And on our website, we've put together some documents so people could learn about where federal dollars go for cancer in Virginia. And so some of those resources are on our website if you're interested. And we also have some updates on where some of the challenges have come directly to some of the programs in Virginia. So that's 2025 and 20 last year. We had some successes where we were able to get some breast cancer diagnostic cost coverage covered in Virginia by Virginia insurers. So as strange as it seems, mammograms are covered, but then if you had a positive result, the next step to be diagnosed with that was not covered. So we've made some changes so that that would be. And that similarly was done the year before for colorectal cancer screening coverage, where if you did one of the at-home tests for colorectal cancer, if you then came back positive and you need to get a colonoscopy, it wouldn't always be covered, the colonoscopy. So that has been changed, and those have been changed in Virginia. So now there are laws that those should be covered. And then we also this past year worked on the Medical Debt Protection Act, which went through. So those are a couple things about what we've been working on the policy side. And then how can you get involved? As I said, we're a membership-based organization. It's everyone who's interested in cancer can be a part of our coalition and really help us make a difference here in Virginia. So you can become a member. With membership, you can participate in one of our implementation teams. You can talk to your colleagues and community about the Virginia Cancer Plan. This, as I said, it's the fifth version of the plan. We've been around for 20 plus years, and many people don't know that Virginia has a plan to really tackle cancer. And then you can attend our events. We have quarterly meetings, March, June, September, and December of every year. And then I'm really excited to tell you about the Virginia Cancer Conference. So the conference is this year. We host it every other year, September 11th and 12th, and it'll be in Richmond this year. But this year we're having for the first time a pediatric track. So we have on Thursday, um, from 11 to 3:30 are just a focused area on pediatric cancer. So we're excited about that, and you can find information about the conference on our website. And then, of course, this is just to encourage you to join our efforts. We really, like I said, it takes out all of us. And so we hope you'll consider joining the coalition. And then that's our email to reach out and our website, and we're on social media too. So I can stop. There was a lot of information. So I can stop sharing my screen and answer any questions or whatever anybody might have.
Yeah, thank you for that, Jessica. Super appreciate the presentation. Any questions?
Bailey, can you and Jessica speak to how the two of you work together for Ask? Like, do you guys come like we those of us that have been involved with advocacy before for Richmond Days? Um, has the Cancer Action Coalition been there at Advocacy Days also, or is it just Ask, or what role are you seeing might be helpful to us to what will move this forward the best?
Jessica, do you want to start? Or
Sure, I can start. We do have members. I don't know. Amy Godkin is the chair of the coalition, our board chair. So there's involved in the team at Ask. There are a number of staff that volunteer and participate with the coalition in different activities. We have not. So our advocacy and policy work has really just started in the last year or two. So we don't have a day that we go. We do partner with our colleagues at the American Cancer Society Cancer Action Network, and then our one of our other members, Virginia Breast Cancer Foundation, they have a day, and some of our members do those things, and you all have that day too. But we have not. Again, we're still new in some of our policy work, so we don't actually have a day ourselves, but you know, our efforts get supported through some of our members. Hope that answers the question a little bit.
yeah, and just to kind of continue on with that, like like Jessica said, Amy is part of that, and so we kind of fit the role of the pediatric kind of advocacy portion of that state plan. Obviously, there's other groups that are involved in pediatric as well, but we kind of that's since it's ASK's focus, we do a lot of that advocacy work. And as far as our advocacy day, um, because that is specific to ASK, like we keep that within ASK advocates and people who are there for the purpose of pediatric advocacy. But would love to kind of start to expand that to partner with more people and these other groups that are working as well to make sure that we're doing that collaborative effort. And I think with CACV kind of laying that foundation now and starting to build their advocacy program, we can start to do that as well. And then we'll plug into the work they do. Depending on what their advocacy program ends up looking like they can support what we're doing, and becomes more of a partnership. So.
I think that's great. The reason I'm asking is that I don't know some other people that are on here. I know a couple of you guys that are on there. Hi, Jess and Allison. But I think that most of us get into this obviously because we've been impacted by it, and we are, continuing to be impacted by it, or we have felt like we can make a difference, or we want to make a difference. We look in there, and yet sometimes, like with September coming up, I know my inbox, just because I've been doing this for a couple of years now, not very long, my inbox is filling up with all kinds of activities and events to go to in September, and things that are in DC and things that are in Richmond and things that are in Charlottesville. And I'm going, whoa, where's the best place to get involved? Is it local where you're at? I'm not really anywhere. I'm kind of in the middle of nowhere. So I kind of pick and choose. Is it better to be in person with somebody? Is it better to, like, how do you pick which one to put your efforts and energy into, I guess?
Yeah, I mean, I would say I think that comes down to kind of where your capacity is, and I guess prioritizing your interests on a personal level. having so I mean, if I'm speaking for Ask, like our advocacy day is such a good opportunity to directly connect with legislators. Like they always appreciate the in person as much as possible. Getting that face in that story is really, really impactful. But that doesn't mean that, virtual outreach over emails or elevating issues, through social or whatever it may be, isn't also impactful. So I guess um, the point that I would make to that question is like evolve yourself as much as you're able to. And there is so much opportunity because there are so many people doing great work. And at a certain point, you just kind of decide what your personal priority is. And whatever you are able to put into it is fantastic and appreciated. And um, I think that, the more local you go, the more like direct impact you have. But that's not to say that working at the federal level doesn't, or helping at the federal level or the state level doesn't also isn't also great work. Sorry if that does that answer your question. I
Well, that
maybe
does, like, I guess, is Ask doing any kind of a big push this September, like you did last September? I'm wondering, kind of thing.
okay. So it's our 50th anniversary this year, so we are not doing a Glow Gold campaign. Just because the 50th is laying on top of that, and so just for organizational capacity, we are kind of using that as like our big you know social media comms uh, story for this September, and then Glow Gold will pick up again next year. We just having them on top of each other, it just was a lot for Ask as an organization to kind of handle, and also we didn't want to inundate people with more than what was productive.
Totally, I can understand that. And then Jessica, I was just wondering, like, um, if could you explain maybe a little bit as to what would be asked if we wanted to join the coalition with you guys? What kind of,
So,
where use this at?
so I think the coalition really is I feel Bailey, it's like it's up to you how much you want, but that's really what this is, similar to what Bailey said. The coalition is really a place where I feel like you can come and you can do as much as you can do a lot, or you can just you like to attend a meeting and know what's happening and it's an educational piece, or you like to connect with other people. So I think it really can be whatever it is that you want to make it and what the involvement you want to get from that. Um, so I, I
Is
mean,
there is
I
there
think that the pediatric group, like if you're interested in that, I think that we're again, and we had started it and it was like a soft start. Let's see what people are interested in. And then, like I said, in 2026, we're officially doing it. And I think if people are interested in that, it would be a good place to connect and see how we're hopeful that those groups, what they do is we work together to really try to see, is there a piece of this plan that we can help move forward? And sometimes it can be daunting because these are such big goals and objectives that you're like, how are we going to do that? But it's together, really, small groups of people can really do a lot. And that's what we found. So I think if you're considering it or interested, I can maybe maybe Bailey can share any contact information and I can add you to our list. And so then maybe you can come and attend a couple times and see if it's interesting to you and then join the coalition. It's however you think you might want to participate, I think.
and is most of it virtual, or I saw you have it in.
Most of it is virtual. We cover the entire state, so in order to engage as many people as possible, most of our meetings and our events are virtual. We do usually one in-person meeting a year, so this year it's the conference.
Okay, and I know Ask is incredibly active and proactive and has things happening, and we've in advocacy days it's been so rewarding to be there and see, oh my gosh, we actually have education support navigators now and that kind of thing. And Jessica and Allison and I are on a family advocacy network group at UVA, and we meet quarterly, and it just feels we've been doing this for, gosh, is it 2.5 years now, guys? And yet there's nothing to show. And so it's kind of been a little bit, and I think they were going to kind of have some term limits and stuff, and so I think we're all kind of going, where can we put our energy, you know,
Right.
with
No,
all
I
the circumstances that are going on. Some of us are off treatment, some of us are bereaved, some of us are in the thick of it, kind of going, we have to step on and off as we go. But I guess we're all, for me, I don't know, no one, sorry, I'll stop talking after this, but I'm just wondering where would be the best, place to put our efforts and energy to try to see some results. And you guys, I mean, can you tell me again, where are you guys funded from the
So we
department?
receive funding from we have multiple sources of funding. We are our own 501(c)(3). Where even though do receive, we're part of CDC's National Network of Comprehensive Cancer Control Programs. That money goes to Virginia's Department of Health, and we receive funding from them to run the coalition. But we also receive donations and corporate sponsorships and other funding from other. We receive funding from UVA and VCU and Inova and others of like that to for our efforts. So
And is it a paid staff? You guys have like, do you have an office anywhere, or is it just?
we do not have a physical office. We have two staff, myself and a program coordinator. And my program coordinator, Allison, she coordinates all of those implementation teams. So she works with our pediatric group too and all the others. That's what she coordinates.
Okay,
We're a small but mighty team.
that's what I'm wondering. Thank. That's great
You're
to know
welcome.
in the background.
Okay. I have a quick question, and it may be a bit out of place. So I'm the bereaved mom that Lenny was just referencing, and since my son's passing in March, I've been invited to three different sit-down meetings with both state and federal level politicians, and the state level honestly was infuriating. I had somebody else that had arranged the meeting, and they invited me to come along and sort of share our experience and just sort of shine some light on some of the problems and issues that we saw during my son's battle. And the politician like literally scratched his head and was like, "This just sounds like a federal level issue to me. I don't know what you think we could do at the state level." So I guess my roundabout question to you is, with the ask days and with the coalition you were mentioning, like having that time with the politicians and they're putting faces to names, how much of a push and an understanding for the coalition, especially the pediatric portion of the coalition, is happening right now?
So so I don't know what the specific issue was that you were talking about with the state. But I know just as an example for us that I refer to the colorectal screening. That was a federal law, so that should be covered, but they made it a law in Virginia. So it's protected here. So I think sometimes some of the things we're doing, even though there's a federal protection, it's best to have it, at least I learned from some of my policy folks, to have it codified into law in Virginia so that you as a Virginian know this protected, especially now when many things might be changing at the federal level. We know in Virginia that would be something that we would have. So I don't know. I don't know what the specific is, and I'm not a policy expert, but it seems like there could have been room at least to talk with you about how things could change here in Virginia to be better. But for the coalition, you know, it's a battle of trying to make people aware that we exist, that we're a community working together. I think not siloed in this group here and this group here, but it is joint effort. But with policymakers, we're still working I went on foot and handed out a cancer plan in 2023 when it came out to everyone in the General Assembly to say, do you know we have one? And a lot of them aren't aware. So I think it's a constant, and I'm sure Bailey feels this way too, for as much as effort you think you're moving forward in that, you're constantly always trying to make people aware of what the issues are and what needs to be done.
Yeah, and I will just say from Ask's side, we are obviously our advocacy day is our biggest push to really educate uh, the state level officials about childhood cancer issues and kind of the experiences that families actually go through, not just this high level statistics that that people can easily see. So to answer your question, we are this upcoming year, with the change of budget, the new administration, new electeds coming after November, we're going to be we're doing a push to meet with more of the electeds, make sure that they are aware of, the issues that that not that we represent, but that our families go through, because unfortunately, they don't know without us telling them, because they are maybe lucky not enough to have not gone through it before, or just have not been exposed to that experience. So we are trying to make sure that they have a good understanding, and trying to make sure that we are being as proactive as possible, so that going into session, they know who we are, and they know what we do for the families, and what the families that come to us experience. Does that answer your question, Jessica?
Yes, I guess basically what I was trying to get around to was you know, how upfront and I guess sort of in their face, how frequently are you guys making connections with people that are making policies that are definitely impacting pediatric cancer? Because like I said, this is someone that's supposed to be, making decisions that affect pediatric cancer in the state, and he's scratching his head like, I don't even understand why you're talking to me about pediatric cancer. So it was frustrating, and it's good to know that you guys are out there, advocating. Um, so I guess I wanted to just sort of hear what the push looked like. So yeah.
Yeah, I would say the push right now, it looks like, making sure that they have at least the materials that we've made. So, one pagers information, are seeing, the stories that we put out. So trying to send those to electeds when possible. In-person meetings, logistically don't happen as often as, I would love for them to. But we're certainly doing outreach, so that session is not the first time they're hearing from us. All right. Any other questions? I appreciate the dialogue, y'all. Thank you so much for asking them.
Thank you so much for inviting me. I enjoyed the opportunity. I always like to share what we're doing. And please, if you have any questions or want to reach out or want to check us out a little bit or attend an event, just let me know. I'm happy to
Just kind of
invite you and have you join us.
one other question. I've been to advocacy days in DC, and I'm trying to remember the name. I think it's the American Childhood ACCO, I think it is, or ACOO. Are you guys part of that at all? And I want to say that there's like 300 or 400 people that go to that one, and you actually go up on the hill and get assigned, much similar to what we do in Richmond. I've been to that one, and it's got a lot of industry scientists and doctors that are there also, that are doing a lot of policy work up there. And then the American Cancer ACS, is that American Cancer Society?
Their Cancer
And
Action Network is their policy arm.
yeah, and they had individuals that were there that were, because they try to represent all 50 states at that event. And they had someone from the state of Virginia there, and they were talking about, do you guys work with them? Like,
Yes, we do. We do.
trying to figure out how it all connects. Like I said, it seems like with all these different groups, I'm kind of like, okay, where's everybody? Are we overlapping? Are we all working for the same? I think we're all working for the same goal, but it just feels like there's a lot of different ways you can try to get involved, and you're going, which one? Like, because they were like, oh, we need people to be, I can't remember what they call them, representatives or something, that are or liaisons or something like that. And I was like, but are they working on pediatric versus adult cancer versus,
Yeah, so they work on for all cancers. I hear you, because there's so many different types of cancer, and then there's so many different cancer organizations, and some work in research, and some work in direct patient services, and some are in advocacy. So it can be very confusing of where to focus your efforts. And again, this goes to what Bailey was saying, sort of deciding where you connect with people and where you think you want to make the most effort. Some people want to go national and federal, and some people really want to work within their own community. So I think I feel like we're not answering your question by just saying decide, pick one, but it's just, I think that's what it comes to. And I also, like me, I always think I like to go where, I've connected with some other people who are like me, and that I have some, friends along the way to do this, where,
Right. Well, that's
So
how I connected with Ask. I mean, is someone I knew connected to Ask. What is the Virginia Pediatric Oncology Group? You mentioned that.
that's one of our implementation teams that would
Or
focus on our section of the cancer plan.
so out of your cancer plan, you would focus on you would have you don't do you have that? You said you just started in 2024 and it's not quite there yet.
Yeah, that group, we
Yep.
have the section in the cancer plan for on pediatrics, but it's been there for a long time. But the us a group specifically like spending some time and working towards it, that is the new group that we're starting to put together.
And I know you mentioned this before, but it's all starting to click in my head. And you guys actually work with legislation and policymakers there in Richmond to try to like do
Yes,
they
our advocacy and policy committee, they do, yes.
okay. Out of your group, your Virginia, what did you call it? CACV?
Yeah, CACV, the Cancer Action Coalition of Virginia.
Have
It's
to
a
know
mouthful to say, so CACV is what we go with.
you have to know what these things are, or else you sound like a dork.
Yes,
Okay.
yes.
Okay, well, awesome. I feel like I've come
Great.
away learning a little bit. So thank you. I'm just getting
Thank
involved with
you.
politics just right now, so I'm trying to figure out how things all tie together.
Absolutely. And it's a lot. There's so many different pieces and they how they connect is always difficult, but I appreciate your questions, serious, very, very genuinely, because I think a lot of people have them. Um, any other questions? By no means I don't want to sound like I'm rushing anything. All right. Well, Jessica, if you don't mind, would you be willing to send me your PowerPoint and I can
Yep.
send it out along with the recording, which I'm going to go ahead and stop now.